My name's Chris Burquest. I'm the therapy team lead from the Community Integrated Response team. I think what really made me excited about doing the QI project was we were asked to come with an idea. It wasn't directed. So I'm full of ideas, so I love anything like that, so I just had to do it. It's falls, plain and simple. So I think falls are one of the biggest contributing factors to frailty. They are, as we know, with age, your chance of falling increases. 90% of all referrals that come into the Community Integrated Response team are all directly or indirectly associated with a fall as well. So what we needed to do was we needed to try and capture the best way of preventing falls. So what we do is we see revolving doors of people that have had frequent fallers come into the system. We know those patients are going to fall. We've tried where possible to reduce those falls. We've tried to engage as much as possible with them, but ultimately they're always falling. And then what happens is clinicians will look back over the records to see what we've done in the past, what interventions we've brought about, and it's not plain, it's not simple for the healthcare professionals, the multidisciplinary team over Wirral Community Trust to access that information. And also as well for the patient, they're getting asked the same questions multiple times. So from their perspective, if they're a frequent flyer, they're thinking, I know what you're going to say, I know what you're going to ask me. Actually, this is my choice, this is my life, you're in my house, what difference are you going to make right now to me by asking those questions? And there presents the revolving door. So initially, the solution and the QI project focused on devising a falls assessment. However, it evolved with the QI project to exploring a falls assessment or a jointly owned falls assessment between clinicians and patients, shared decision making, and I think that is all largely down to the QI project and the personalised approach that we took to it. So what we've got up and running now is a standardised evidence-based assessment on System 1, which is where we type and record all our notes. And on there, every single clinician will use that, and it's on what's called a first responder template. So in Community Integrated Response team, and we'll have, whether you're attended by a nurse, a paramedic, occupational therapist, physiotherapist, or our assistant practitioner, the idea is everyone will get the same assessment. And our overall aim is to prevent admission to hospital or prevent going into a social crisis. However, what's happened because of the QI project is it's now evolved. So it's gone from being a standardised assessment where we would go in and we would say, how did you fall? When did you fall? What were you doing when you fell? Were your animals around your feet? Did you have appropriate footwear on? Questions which, with the benefit of hindsight, put the clinician as kind of like the expert. However, what we're doing now is we're saying to people, this is your house. I'm here to give you advice. So how within your life can I make it that little bit better so you don't have any more falls? This is the benefit of my expertise for you. You can choose to take this if you want. Is there anything more that you want from me? And that instantly is seeing people engaging, and we're capturing that on System 1, but equally as well what's happening is because we're recording it in one place, we're able to produce the data. So if we've got multiple fallers and they're coming back into our team again and we're going out to them, we don't have to ask the questions again. So, and what we're starting to do now is produce a leaflet with the advice on, so it's there for other professionals who go into the house, care agencies, families, third sector providers who go into the house so they can read our hopefully co-created falls reduction plan. So then what we're ultimately trying to do is get buy-in from the patient to what we're saying, so it's not seen as advice, it's seen as, okay, this is what you live and breathe, hopefully, to prevent your falls. Believe in yourself, because actually that idea that you've got, you've seen it, you believe in it, it's not an idea for nothing. And I think that's the thing, you've always got to keep those ideas. I'm a total ideas person, and I think that's what, if you can get that idea and make it a reality, your next idea you'll have even more belief in, and it'll become a reality quicker, and then all of a sudden you kind of look back with reflection and think, oh wow, I've really made a difference. And also you grow yourself as a clinician and a person as well through it.